Uh, Thank you, ma'am, for the introduction. And before we walk you through the live demo, I would like to say a few words about the hub here. So, Honorable Chief Minister, Mr. Conrad Sangma, respected dignitaries who are at the launch and also who are joining us remotely. I'm Dr. Paul Francis. I'm a senior clinician working here at the SDH General Hospital. The General SDH Hospital has also been designated, as you heard, as one of the hubs in Meghalaya. Uh, if you can see the screen behind me, this hub is currently connected to 7 spokes in Garo Hills, 5 in the Garo Hills region, 2 in Jawai, and 1 in Ganesh Das Hospital at Shillong. Soon, this will be broadened out into, as we heard earlier, 14 spokes here and 2 hubs, 1 at Jengjal and 1 at the Ganesh Das Hospital. Apart from providing support for critical care to all the spokes, this hub is also involved, as you saw in some of your videos, training also in collaboration with CMC Velo to all the doctors and nurses who will be there at the spokes, not only in basic critical care, but also in advanced critical care. But before I hand over the time to Dr. Susie for walking us through a live demo, it is our privilege once again to thank the Government of Meghalaya, the Honorable CM, and also the EGA Foundation, the 10-bed ICU, and also the various donors as we heard here. For setting up this whole innovation here. You know, it's very important. You know, what we call as the golden hour, you know, in critical care, it's very important. Any patient, we heard some of the algorithms which have been developed for critical care. It's very important that critical care, access to critical care comes as close to the communities. And this is very important, especially for us who are working in remote areas, where access to critical care and also the connectivity, both in terms of geographical connectivity as well as to the internet connectivity, may not be very optimal. So thank you once again for everyone for setting up this innovation, and we are committed to support to take it across the state. Now I hand over the time to Dr. Susie Paul, who's a senior obstetrician and gynecologist and also in charge of the HDU here, to walk us through a live demonstration through one of the spokes in supporting critical care to a patient who is admitted in the ICU. Dr. Susie?
Good morning, respected Excellency, the Chief Minister, respected dignitaries, and my colleagues. Today I'm going to walk you through the CARE platform and show you how you can communicate with the spokes in different regions. So today I'm going to take you to William Nagar. As you can see on the screen, all the spokes are given here. Then you come to William Nagar, click on the patients, and you come to the area of how many patients are admitted. See the respiration, the pulse rate, and the oxygen saturation. As you can see, this patient has 63 pulse rate, SpO2 of 97, and her respiratory rate of 13. You can also go to a platform where you can actually view the patient. You can see the monitor. You can also have a face view of the patient and can go up close to see how the patient is. You can also have a bed view so that you can have a look and see that how the patient is, whether there's any complications. Then you can also have a look at the medicines that the patient is getting. As you can see, she's on IV injections. You can also have a look at her files, and you can see that there are some investigations. You can zoom in, and then you can, of course, zoom out, and you can see all these things on the screen. Now we will go for a live demo with the doctor at the spoke in William Nagar. We're going to connect to her by WhatsApp. Good morning, Dr. Salmachi. How are you?
I'm well, ma'am. How are you?
I'm fine, thank you. I just had a look at the patient that you referred to us. Vital seems to be okay this morning. Is there any other problem that you're having with the patient?
Ma'am, actually, her BP has been fluctuating, ma'am, since last night. Now also her BP is 180 by 120.
Okay. Is she on labetalol?
Yes, ma'am. She's on injectable labetalol.
So I think you can continue the injection labetalol whenever the BP goes up. And if she's stable otherwise, then just leave her alone. I also saw in the investigations that she has some elevated renal function tests and liver function tests. Maybe you can repeat that again and see that, whether it's coming down or anything else needs to be done. I hope the urine output is okay.
Yes, ma'am. Since 21 hours, it has been 800 ml, so it is adequate now.
Okay, so I think we need to keep an eye on the urine also so that she doesn't deteriorate. Okay, thank you, Dr. Salmachi. Also, I'll be connected by WhatsApp also. There's an app on the connected to my mobile. So I'll be available all the time. So in case you have any problems, you are free to contact me anytime. Thank you.
Thank you, ma'am.
Okay.
Thank you, ma'am.